Today, we stand at a critical juncture in global public health, where multiple viral threats are converging across continents. From preventable childhood illnesses to emerging zoonotic diseases, the landscape is changing rapidly, demanding heightened awareness and proactive response. In the United States, a troubling resurgence of measles is unfolding. The outbreak, which began earlier this year in the Southwest, has now expanded into multiple states with hundreds of confirmed cases. Particularly alarming is the demographic shift. Infants, young children, and immunocompromised adults, many of whom remain unvaccinated, are disproportionately affected. 2 fatalities, a child and an adult, have already occurred. This resurgence is not due to viral mutation, but rather to declining vaccination rates, fueled by misinformation and complacency. Public health officials warn that without a significant increase in immunization coverage, the outbreak could persist well into next year. Meanwhile, Australia is grappling with a sharp rise in influenza cases, with infection rates already 50% higher than the same period last year. In just 1 week, certain states reported thousands of new cases and dozens of hospitalizations. The flu season, typically peaking in the southern hemisphere around June and July, appears to be arriving earlier and more aggressively. Medical authorities urge the public to receive influenza vaccinations immediately, especially those in high-risk groups such as the elderly, pregnant individuals, and people with chronic illnesses. The pattern mirrors global observations that post-pandemic behaviors, reduced masking and increased mobility, are contributing to the resurgence of seasonal respiratory viruses. Further north, cruise ships sailing international waters have become the epicenters of another wave of norovirus outbreaks. Known colloquially as the stomach flu, norovirus is not influenza but a highly contagious gastrointestinal virus. On 2 separate luxury vessels, hundreds of passengers and crew reported symptoms including vomiting, diarrhea, and abdominal cramping. In both cases, quarantine protocols were swiftly implemented, and enhanced sanitation measures were introduced. However, due to the virus's resilience and the confined nature of ship environments, transmission control remains a significant challenge. Central and Eastern Africa are now witnessing a surge in cases of mpox, a viral disease that has historically remained endemic to certain regions. This current wave, caused by a more virulent clade, has prompted international health agencies to issue alerts for travelers. Unlike previous strains, the present clade demonstrates increased transmissibility and presents a higher risk of severe outcomes. There are growing concerns that cross-border spread could occur, especially as international travel resumes to pre-pandemic levels. Individuals traveling to affected regions are urged to take personal precautions and monitor for symptoms such as fever, rash, and swollen lymph nodes. Adding complexity to the virological landscape, Chinese researchers have recently identified a new bat coronavirus capable of infecting human cells. The virus, while not yet detected in humans, has shown high affinity for human receptors in lab models. This reinforces what many virologists have long warned, that animal reservoirs, particularly bats, continue to harbor pathogens with pandemic potential. The importance of sustained genomic surveillance, ecological monitoring, and rapid response virology cannot be overstated. In regions of the Caribbean and South America, dengue fever has seen a marked increase in recent weeks. With the arrival of spring break travelers, popular tourist destinations such as Puerto Rico and island nations are reporting significant spikes in infections. Dengue is a mosquito-borne illness that can cause flu-like symptoms, and in severe cases, hemorrhagic complications. The uptick in travel, combined with ideal breeding conditions for mosquitoes, has created a perfect storm for the virus to thrive. Travelers are encouraged to use insect repellent, wear protective clothing, and be vigilant for symptoms both during and after their trips. A different viral threat, Lassa fever, is affecting communities in West Africa. This hemorrhagic illness, transmitted through exposure to infected rodents or their droppings, has caused numerous deaths and overwhelmed healthcare systems in affected regions. Unlike Ebola, which is often contained through rapid isolation protocols, Lassa fever poses a longer-term challenge due to its endemic nature and the difficulty in early detection. Frontline workers continue to call for international support, both in terms of resources and vaccine development, to manage the outbreak effectively. Amid these events, a silent yet significant development is occurring in the realm of avian influenza. Mutations of the H5N1 bird flu virus have been detected in mammalian hosts, including humans, in multiple geographic locations. Though the virus has not yet demonstrated sustained human-to-human transmission, the genetic markers observed suggest an increased capacity to infect humans. Experts are closely tracking these changes, acknowledging that the adaptation of H5N1 to human receptors could have profound implications. Biosecurity measures at poultry farms and wet markets are being re-evaluated as a precautionary step, while researchers continue to explore vaccine candidates that could be rapidly deployed in the event of a spillover. Each of these situations, measles, influenza, norovirus, mpox, bat coronaviruses, dengue, Lassa, and H5N1, represents a piece of a larger puzzle. The interconnectivity of global populations, coupled with ecological disruptions and vaccine hesitancy, creates fertile ground for viral transmission. It is not a matter of if, but when, the next pandemic-scale event could emerge. The lessons of the COVID-19 pandemic remain painfully relevant, and yet, in some sectors, complacency has already taken hold. To address these risks, a multi-pronged approach is essential. This includes re-establishing trust in public health institutions, strengthening global disease surveillance networks, supporting vaccine equity, and advancing scientific communication. Crucially, individuals must take responsibility where they can, by getting vaccinated, practicing good hygiene, and staying informed through reliable sources. What we face today is not just a collection of viral events, but a test of our collective resilience. In an age of misinformation and politicized science, clarity, collaboration, and compassion are the tools that will guide us through. As we move forward into the rest of 2025, it is imperative that global health remains a priority not just for professionals, but for every individual who shares this interconnected world.